Hi, this is Jasper from Milton and Fornham Chiropractic clinics, and we're located in the outskirts of Cambridge and Bury St Edmunds. And we see a lot of patients suffering from sciatica in our clinic, and sciatica is essentially an irritation of the sciatic nerve. And the sciatic, often what we see with sciatica is that the pain is located in the back, the buttocks, the hamstring, the calf and the outside of the foot. And these people very often have difficulty sleeping. They can't get a good night's sleep. So today we're going to give you some tips on how to get a good night's sleep or a better night's sleep when you're struggling with sciatica. So the first thing we're going to do is we're going to apply a little bit of ice therapy. So this is something you need to do before you go to bed. So say you go to bed at 11 o'clock. Start doing this at 9:30 for 10 minutes. Take the ice away, do it again at 10:30, prepare yourself for bed and then go to bed. So ice therapy, all you need is an ice pack. This comes from the freezer, and a little bit of a tea towel. Never apply the ice on the bare back, on the bare skin, because that will give you frostbite. So wrap it up here in the towel, lay it on your bed, on the floor, wherever you want to do it, and then make sure the ice pack is located in the small of your lower back. So you're like that. And that's all you do. You lay on it for about 10 minutes, and it helps to reduce the inflammation, thereby reducing the pain that you're feeling. 10 minutes. After 10 minutes, you take it off, take it out, put it back in the freezer again, and 40-50 minutes later, you apply the ice again. Now, the reason why the people get a lot of pain at night is because of lack of movement. The body needs a bit of movement to be able to reduce the pain. And when you're laying in bed for 2, 3, 4 hours, that's often when the pain comes back again. Now, what a lot of people are hoping to find is this perfect position where the back and the leg won't hurt. But unfortunately, that's very unlikely to happen. So what you need to do when it gets really painful after 3, 4, 5 hours sleep is get out of bed and walk about. So make sure that before you go to bed, you've prepared this walkway where you can walk in the bedroom, in the hall, downstairs, wherever you can walk to get some more movement in that lower back. Do it for 10, 15 minutes. Make sure you get rid of all the clutter. If you can, leave the lights off. Turning the lights on will stimulate some hormones that are associated with waking up. If you can, leave them off, and it's safe to do so, leave them off. But that's what you want to do. After 2, 3, 4 hours, get up and just walk about a bit, get some movement back in that lower back again. Okay, the next exercise the next two things we're going to show you are about sleeping positions. And what you need for them is just a few pillows. Okay, so I've taped up my left leg, so this is my affected leg. This is where I have that pain in the buttocks, the hamstring, the calf, and in my foot, and all on my foot. Doesn't have to be in the foot as well. So you want to lay, in this case, on my right side. I put my feet on top of the pillows. My knees are below my feet, and that opens up this gap and should give you a little bit of relief on that nerve and on that sciatic pain. So try to sleep like this with the pillows underneath your feet. Another position you can try is laying on your back, putting the pillows widthways. There we are. Put your knees top of the pillows here and lay like that. Really make sure you have enough pillows here to support your knees. Now, I've seen some of my patients actually put their feet on some chairs and lay like that in a 90 position, which reduce the pressure of the lower back and therefore reduce the pressure on that nerve. So you can even lay like this. They've actually had a chair on top of their beds to lay like this. You can also, again, you can use the pillows. I mean, you can stack them higher or lower, whatever makes you comfortable, to be honest. Good. Well, so these tips hopefully should help you getting a good night's sleep. So I wish you a good night. Thank you for watching, and bye for now.